Dr. Joshi, is India on the brink of a fourth coronavirus wave, or is it a bit of a stretch to say so?
No, I don't think we are in any fourth wave coming up in the near future. You are getting a sporadic cases and small clusters in the NCR region, Delhi. These are asymptomatic or mild cases of the Omicron variant only, BA2 predominantly, or maybe some recombinants. And there is no cause for concern. They are predominantly in the community. No increase in hospitalization or deaths. Predominantly, we need to protect the vulnerable groups, immunocompromised groups. We definitely need not let our guard down at all. We need to be very vigilant, but no need to panic. Okay. And I don't think any wave is there in the near future in the next 3 to 4 months.
Dr. Seth, what then is the reason behind the spike in cases across north of India particularly? A plausible reason which is being cited is the withdrawal of the mask mandate and doing away with all restrictions.
We must understand that COVID the virus is amongst us. And we're going to see these blips when we open up, when we let the restrictions off. We're going to see these blips. But again, this does not mean this is a wave. We're going to learn to live with the virus. And just like we have the annual flu season where we see rise in flu cases, or even the H1N1, or even for that matter, dengue, it's going to exist with us. What is important to understand, and I think there are 4 important points in my mind. Firstly, taking away of restrictions and dropping the mask mandate should not be considered as a point towards the fact that corona has gone. Carelessness and callousness need not set in. Caution needs to continue. And I think that's an important aspect. I see that carelessness and callousness is coming in because people do believe that it's gone. We've got to learn to live with it. That's my first point. The second point is, yes, we're not seeing admissions into the hospital. I mean, for example, our hospital 40 beds remain vacant for the last 4 weeks without a single admission. An incidental admission of another patient come in for a different procedure, surgical procedure with coexistent COVID picked up as by chance is the only patient we've seen for the last 4 weeks. So that's the second point. Third, we must remember that we are vaccinated, but caution needs to continue in terms of appropriate COVID behavior, not all over the place, but in certainly certain areas, which is like the crowded places, which is like indoors, which are less ventilated. Those are and for those who have comorbidities, the elderlies, it needs to continue very strictly.
Yes.
And finally, I must say that we just want to understand that we must complete our boosters. Yes. Whoever's eligible for booster must complete it because it is an important aspect of staying away from serious illnesses. Genomic surveillance is perhaps going to become the most important at this time because we need to understand what virus variants will come forth, and we need to be clearly on top of surveillance and scrutiny.